What are diabetic foot wounds and diabetic foot ulcers?
The skin breaks down, it's an ulcer or wound.
Can diabetic foot wounds lead to gangrene?
In diabetes, those healing cells, they don't function like a normal cell should. Nerve endings, they get damaged.
So what are the risks for amputation?
Half of your foot goes off.
Oh, we don't want that.
Then half your leg goes off. Imagine you lost your leg. How are you going to walk? And you don't have a proper treatment plan, those ulcers will never heal. So you have to be very aggressive in your treatment to heal these things. Hopefully that explains it and summarizes in an easy way for you to understand.
Hello everyone and welcome to the very first episode of VSH Healthy Talks, a series by Ugadi Specialty Hospital where we break down common health concerns in a way that is easy to understand. Each month we'll bring to you insights from our esteemed doctors who will share their advice on health tips on medically relevant topics. And today, we're honored to have a very special guest, Dr. Mahesh B. Kottapalli, the president of Ugadi Super Specialty Hospital.
Hello.
Hi. So, Dr. Mahesh is a highly respected healthcare leader with over 21 years of experience in infectious disease and healthcare management. His contribution in the medical field have earned him the prestigious award that is Patient Choice Award and recognition as the best doctor by D Magazine. With extensive expertise in healthcare across Texas and India, he's been instrumental in pioneering innovations in VSH. Beyond his role at VSH, Dr. Mahesh is a visionary leader associated with multiple organizations. He serves as a director of Diabetic Infotech, Diabetic Utility, Diabetic Wound Care, Puja and Pujari, while also holding the president at Diabetic Pharma and Biofuels. His expertise and leadership is monumental everywhere he goes. Dr. Mahesh, it's an absolute pleasure to have you with us.
Thank you for having me.
Today we'll be discussing two critical health conditions that have been on the rise in the recent years, diabetes and cancer. When it comes to diabetes, one particular issue that requires more awareness is diabetic foot wounds and ulcers. So we'll focus on that in detail. Would you like to help our audience to understand that better?
Sure.
The first question we have is, what are diabetic foot wounds and what are diabetic foot ulcers?
The ulcer and wound, one are the same.
Yeah.
Okay, wound is a general term that you use, medical term is an ulcer. Anytime there is a break in the normal connectivity of a skin, it breaks down, it's an ulcer or a wound, it's the same.
Okay. Why are people with diabetes at a higher risk of developing foot ulcers?
What happens in diabetes is because of the high blood sugars that are continuously high in your blood, the nerve endings, they get damaged. So because the nerve endings get damaged, people lose sensation in their feet. So that is called neuropathy, also known as diabetic neuropathy. So when neuropathy happens, you don't have any sensation at the bottom of your foot, and you're walking, and you might have a nail that's stuck to your foot, barefoot when you're walking, or when you're walking with your shoes, a nail might go through the shoe and you won't even know the pain. Or you're walking barefoot on the ground and then you have a rough surface that scratches your bottom of your foot and opens a wound, but you don't know that there's a wound, so you just keep walking and eventually those wounds get infected and just pester and then they go into a chronic condition.
So then people with diabetes should be super
very careful about their feet. The moment they are diagnosed of neuropathy or the moment they feel like I don't feel the proper sensation in my feet, they should wear proper footing shoes or sandals that are proper fitting by these podiatrists or experts who make these kind of shoes for these diabetic patients. And then on a daily basis, at the end of the day, either you or your loved ones should examine the bottom of your feet. Just before going to bed, you can ask your wife or your husband, hey, can you take a look at my feet if I see any wounds or anything like that? And the moment you see any skin breakdown, when I say skin breakdown, a scratch or a wound or anything of that sort, or small bleeding, immediately get in touch with the doctor to have that thing taken care of so that it doesn't spread any further.
So how do diabetic foot wounds differ from normal wounds and how can we differentiate that?
A regular wound, let's say that I don't have diabetes. Let's say you have diabetes.
Okay.
Let's say that I'm walking barefoot and I hit my toe. A nail came off or there's an ulcer at the tip of the wound at the tip of the toe. Since I don't have diabetes, I just wash it with water and some antiseptic solution, put some antibiotic ointment on it. Usually it'll heal within a few days.
Yeah.
Just like any other normal person. Even a cut, when you're cutting vegetables, you get a cut, that's an ulcer or a wound, it'll heal up if you're not diabetic.
Yeah.
But what happens in diabetic is, how does a wound heal? Let me ask you that first. The wounds are healed by your body, and the body has specialized healing cells called fibroblasts. So these are the ones that come and connect the wound back together so that it heals properly. So these are active healing cells. Now what happens in diabetes is, in putting in lay terms, it's like if you hire a bunch of workers to build a wall in your house, and you give them lots of alcohol to drink, how will the wall look?
Not as it's supposed to.
Right? It's not going to be proper. It's going to collapse.
Be a good idea.
Same thing in diabetes. Those healing cells are in a drunken state because of the high blood glucose. They don't function like a normal cell should.
Okay.
And that's why they don't come and heal properly.
That's a very good way to put it. It's
simple
very,
terms.
So you can visualize it as well, so you know.
That's why in diabetes, the moment you control your sugar to the point, everything comes back to normal. Your healing processing accelerates, your kidney function gets better, your hearts get better. That's why you say, get your sugars under control, under control, see your doctor. Don't let the sugars go too high, check your sugars regularly. That's why they keep saying that.
That does make sense a lot now. Can diabetic foot wounds lead to gangrene?
Absolutely.
Yeah.
Okay, what is gangrene? Gangrene is nothing but a dead tissue. Okay, there are two types of gangrene. One is dry gangrene, the other one is wet gangrene. Dry gangrene is there's no blood supply to your foot, and either your toe or the part of the foot, there's no blood supply, it dies off.
Yeah.
Wet gangrene is the foot is dying, but it gets infected. And it produces like pus and gas
fluids.
And everything, fluid, everything. That's a wet gangrene. Which one is more dangerous, you think?
Wet is
more dangerous. Because dry there's no blood supply, right? It's dead.
It's gone.
It just mummifies.
It's gone.
Eventually, it'll just break off on its own and it'll just drop off. That's a dry gangrene.
Okay, both are actually really horrifying.
But a wet gangrene is dangerous because the moment the infection enters your foot and it starts producing gas, the infection starts spreading. Why does infection spread so fast? Because your immune cells are not in a very active phase. Why are they not active phase? They are drunk with too much sugar.
Yeah, it all leads back to
the diabetes. And furthermore, what is bacteria like? Sugar.
Yeah.
Sweet meat. So if you're full of sugar, your foot is sweet meat for the bacteria. So they spread really fast.
Yeah.
And that's why gangrene. So a diabetic foot ulcer can lead to a gangrene. Absolutely.
Absolutely. So what are the risks for amputation because of diabetic foot ulcers?
Very high.
Very high.
Very high. It always starts off with one ulcer that happens. It doesn't heal for several months, and then it gets infected. Infection goes to the bone. The bone is destroyed. There's nothing anybody can do. The toe is cut off. And then if you're not careful, then again, a second toe goes off. Eventually, all toes goes off. Then half of your foot goes off.
Oh, we don't want that.
Then half your leg goes off. That's why amputations in diabetes are progressive. So it just doesn't one toe. Like for example, I'm not diabetic. Let's say, again, I'm playing cricket or something and I have my sandals on without shoes and it comes off and I injure my toe, right? I take care of it. It heals. So there's no reason for amputation, right?
Yeah.
At the same time, if I'm a diabetic, it's infected, spreading fast. You need to cut off the infected part to save the rest of it. So that's why you use amputation. Now, once you have an ulcer or an amputation, you're walking on, this is your foot, right? You're walking on 3 points. 1, 2, 3 points of your foot. The heel and the fifth metatarsal and the first metatarsal. That's the weight-bearing areas.
Yeah.
So when you're walking a lot, these are the 3 areas that get all the pressure in your foot. So if the ulcer starts over here and then it starts breaking down, you cut off till here, right? So where do you put the rest of the weight? Now you're putting all your weight on 2 points.
On this part, yeah.
How long do you think those 2 points can handle?
Not for long.
Before that, it's going to rub. You're going to have an ulcer, and then you're going to cut this off.
Yeah.
Half the foot is gone. Then where do you put all your weight? on your heel. Eventually the ulcer will
That
form
is
over
also,
there.
yeah.
That's why it's progressive. So we need to make sure that patients with diabetes have good sugar control,
Yes.
not progress to neuropathy, and have the right shoes for them, right sandals or right shoes for them. So it's not rubbing every time you're walking. There are some sandals, every time you walk, you're rubbing. That's not good.
Yeah.
The shoe should be and the foot should be like this, in total. Walk
So
together.
the weight should be distributed, not
The
just
distribution should not be slippery.
Yeah.
If you
Not
wear a
situational.
sandal, if you wear a sandal, sometimes you're walking, it's rubbing, right?
Yeah, it does.
At the end of the day, you start burning in your feet. Right, so that shouldn't be happening in diabetes. That's why you have to have those snug shoes and snug sandals that are designed for your foot. And that way you can prevent it. Now, amputation again is not something fun because especially people with diabetes are usually on the heavier side, right?
Yeah.
Big belly, obese.
That tend to happen.
So that tend to happen. And imagine you lost your leg. How are you going to walk?
That's going to be a huge struggle. Being
And then-
overweight and then
Now you have to have an artificial leg.
Yeah.
If you have an artificial leg, all the weight is distributed between the artificial leg and this one. Let's say you cut off your left foot or left leg.
Yeah.
You put an artificial leg here and then your real leg. So where do you think you're going to put most of your weight when you're walking? On your real leg.
Yeah, the real one.
Right? This one will be support. So what happens to the weight?
It
Distributes to this
to
side.
the one side.
So again,
then
the
there's
drama
a risk.
starts all over
Yeah.
here again. You get an ulcer again, amputation. Bilateral amputations are a risk. Some people have amputations above the knee. So it is a very, very dangerous thing for diabetic foot ulcers. Unfortunately, not a lot of people understand the concept of it, that how aggressive it is to heal that ulcer. Some of them fester it for months. They keep giving some kind of nonsensical treatment, not doing the appropriate treatment, and that will lead eventually to amputation. Some people go to the doctor every week, they change the dressing, they put some kind of nonsense on it, and then eventually you come back again next week, change the dressing again, put some oral antibiotics. But the whole crux of it is not understood properly. If you don't analyze the situation properly and you don't have a proper treatment plan, those ulcers will never heal.
It becomes a huge cycle that you have to go through again and again.
Yes. And it's not fun.
No, it definitely not is. So does diet play a role in wound healing in diabetes?
Absolutely. Absolutely. If you have an ulcer in your foot,
Yeah.
if you know that it starts leaking, first there's initial blood and then blood stops, and then you have this clear fluid that is leaking out. What do you think that is? Protein.
Oh, that is protein?
Protein.
Oh.
You're leaking protein. On top of everything, because of your diabetes, your kidneys are damaged. And then you are losing protein in your urine.
Oh, most people think that the liquids are just excretions that need to go out.
It is part of protein is highly proteinaceous stuff.
Oh, okay.
Okay, so you're losing protein in the wound, you're losing protein in your urine. What happens when you lose too much protein? Your body
Then-
swells up.
Yeah.
And then what happens to the healing cells?
They don't
They work because protein is a building block here.
Yeah.
So for patients with diabetic foot ulcers, number one, it's very important to be in touch with an endocrinologist. Get your sugars controlled to the T. When I say to the T means their A1C should be below 6.
Oh,
That's how tightly it should be.
yeah.
Okay, and then second thing is protein. Make sure you have enough protein in your diet, good protein intake. Number 3, get in touch with a kidney specialist to check the urine and see if they're actually losing protein. There are some medications that can prevent that. Okay, getting your sugars under control also decreases your protein loss in the urine. Okay, and make sure you don't eat too high sugary stuff, carbohydrates. Okay, that you need to cut down on
Yeah,
that.
level on
More of a protein diet. Less. I mean, you shouldn't be pure protein again. No.
that. Yeah.
High
Balancing it with
balancing it. A little bit higher on the protein, lower on the carbs, so that your sugars are not going boop, 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 boop. It should be constantly stable. That's how it should be. And then you give insulin to keep that thing stable.
Yeah.
So diet plays a major role in it. Absolutely.
Yeah. So how can people with diabetes prevent foot ulcers?
get the sugars under control. Make sure you have good walking shoes or walking sandals that are fit for your foot. Don't just go to any random shoe shop and just buy, I'm number 7, give me number 7, put it on and walk away. No.
They should invest in this.
Yes, that is a good investment.
Yeah.
Okay, it's not a whole lot.
Yeah.
It's actually this, I would say, the same price as a branded Nike shoe or something like that. It's same price. Actually, sometimes it's lesser.
Because it might save you
So
from
you need to
future
have an
amputations.
expert look at your foot, get a footprint properly evaluated, take a scan of it, see where the pressure points are, and then adjust and design a sole adjusted to those pressure points. And once a year, just change the shoes. It's a simple investment you have to do.
Yeah, that would help you in the long run, basically.
Yes.
So what are the tests performed in VSH that would assess the severity of the wounds caused by foot ulcers and diabetes?
Diabetic wounds are, again, at various stages. Stage 1, 2, 3, 4. Okay? Stage 1 is just a superficial wound. Stage 2 goes a little bit into the fat tissue and subcutaneous tissue. Stage 3, the muscle is involved. Stage 4 is bone. So first identify what stage it is.
Okay.
Then what we do is we actually assess the problem. First of all, is it a diabetic foot ulcer, or is it an arterial ulcer, or is it a venous ulcer? Because what happens is, I give an analogy. If you don't go have good blood supply to the foot, no matter what you do, it's not going to heal. Again, I'll give another example. If you have a house, imagine you have a lawn in front of your house, right? Nice and green lawn.
Yeah.
And you have some kind of a sprinkler system or something that is putting water on it on a regular basis, right? And then one day you come in and you see right in the middle somewhere, there's a dry patch of grass, right?
Yeah.
What are you supposed to do? You go to the market, you bring some nice expensive fertilizer, you put in that middle of the thing. You think it's going to grow back?
No.
What do you have to do?
The water supply should
The
be
water should be readjusted so that that area is also getting water.
Yeah.
Same thing with the foot. Imagine your whole foot is a garden and it is nice and pink, healthy tissue because there's blood coming from your leg down to your foot.
Yeah.
What happens in diabetes? And they have this something called calcified plaques in your blood vessels, basically plumbing issue. So this water supply or blood supply that's coming here is blocked. So we have to assess and see, first of all, is there blood flow coming to the foot properly? That is the first step. And second step is, if there is no blood flow, we need to do an angiogram and we need to talk to the doctor, see if they can do an angioplasty. The angioplasty is opening it up so that the blood will flow properly. And see at what point the blood is coming to. They can tell you, they can say the blood is coming up to here, or up to here. You have to determine that. Is there anything else you can do to improve it? Because some diabetics have something called microvascular disease. There's nothing you can do about it because the tiny blood vessels are calcified. Calcified means they're like hard rock. There's no blood flow going and there's nothing anybody can do about it.
Yeah.
But there are some patients who have some blood supply enough to heal the wound. So you have to assess that. That's called something called peripheral arterial disease. So we start with that first.
Okay.
So we have certain equipment and we do something called ABI, ankle brachial index. That's the first step we start. Second thing is see the infection part of it. Where is the infection? How much of it is infection? What infection is it? So we need to check and see the infection part of it. Then we do some imaging to see how deep the infection has gone.
Yeah.
Is it just stage 1 or 4? Like I said, 4 is the bone infection. If the bone is involved, then we have to look and see how much of the bone is involved.
Yeah.
Is it just the top of the bone or the complete bone is involved? If the complete bone is involved, then just better to amputate. If it's just a superficial one, you need to be aggressive with antibiotics. Oral antibiotics will not work. A lot of people misunderstand that. Because what happens when you take a pill, where does it go? It goes into your stomach. From the stomach to your intestine.
Yeah.
From the intestine, it comes to the liver. Liver processes most or 80% of it.
Yeah.
And it easily either urinates it or in the fecal mixture it's gone. The rest of 20% goes to the heart. From there goes to the lungs. From the lungs back to the heart. From the heart again it distributes all over the body. By the time if all this process is done, how much antibiotic do you think is reaching the foot?
Not much.
Is it enough for them to heal that
No.
ulcer, especially in the bone?
Definitely not.
No. That is why people misunderstand that, and we have to explain to them saying that intravenous antibiotics, you have to get them in the IV vein. Antibiotics for at least 6 weeks, sometimes 8 weeks of daily antibiotic therapy to get that infection under control. On top of it, surgical options, debridement, regular debridements. See, because you come in, debridement means scraping off the wound, removing all the dead tissue as much as you can, and give the chance to get the fresh tissue to come back. But then again, the body doesn't like the wounds to leave it open. It likes to cover up with some kind of a layer, and it's called fibrinous layer, and the wound stops again because it gets a false message saying that the ulcer is healed. So they have to re-scrape it again next week. Some people don't understand, why is this doctor scraping every time?
Yeah, it's already done.
Yeah, no.
Yeah.
Because you're removing the biofilm and the fibrinous tissue, you remove it regularly so that this will heal properly. Okay, that's surgical debridement. So you have a vascular surgeon involved or a intervention cardiologist involved. You have a surgeon involved. You have a general doctor involved for antibiotics and infection control. You have an endocrinologist involved for sugar control.
Yeah.
It's a multidisciplinary approach. You need so many people to work together to heal that ulcer.
For all the aspects, basically.
All the aspects, control it completely. And then usually what happens is the surgeon plays a small role sometimes, maybe initially, and then after that there's no role for him. The endocrinologist plays a small role. He gets the sugars under control once a month. You see him, that's fine. And the regular doctor and the wound doctors are the ones seeing you once a week. And then the final icing on the cake is called hyperbaric oxygen treatment.
Yeah.
And VSH hospital specializes in that. We have a hyperbaric oxygen chamber. What that does is we make the patient go into the chamber and sleep there for 1 hour or 1.5 hours every day for about 10 to 20 days. Every day you come in, you sleep there and go home. So what it does is it gives you pure 100% oxygen under high pressure. What that does is mixes the oxygen into the plasma, not just the red blood cell, it mixes into the plasma. So high level of oxygen concentration is reaching your foot. What does a tissue require to survive? Oxygen. How does oxygen come down there?
Through breath.
If you put oxygen tank right there on the foot, you think it's going to work?
No.
No. It has to go through your lungs. You have to inhale it, goes to your lung, mix with the blood, and then go down there. So hyperbaric oxygen treatment helps healing much faster. Then because the granulation tissue is going to grow really fast, and then the wound will heal faster. So we have all these multidisciplinary approach protocols set up at VSH. We are experts in wound care. We have healed the most nastiest of the nastiest wounds, including necrotizing fasciitis. Patients have been successfully healed. The only caveat here is you have to trust the doctors. You have to come in. You have to understand. You have to get some radiologic images, MRI, X-rays, whatever needs to be done. You have to undergo all these procedures, make sure everything is perfect, and then start the whole healing process.
Yeah, that really sums it up from stage 1 to the last.
Because
all the
if you just do the one part of it, well, how many did I tell you? Vascular, debridement by surgery, endocrinology, and you have general doctor giving antibiotics and a wound care physician. 5 people, sometimes you have plastic surgeons involved to put a skin graft if it's a big ulcer. So many people are involved to heal that ulcer. Here what happens is some people just try to treat it with one person. Every week they go, they do some dressing on it, put some liquid on it, put a dressing on it, give you some oral antibiotics, send you home. They'll not heal.
Yeah, that's not the right approach.
They'll not heal. Eventually they'll have an amputation. If not, the amputation might not happen immediately. Because when it goes deep into the bone just doesn't destroy like that in one day.
It's progressive.
It's progressive. It takes months for the bone the infection to slowly erode into the bone and eats the bone completely. That's when you have to amputate. So you might say, I'm fine today. Oh, in 1 month also I'm fine. But the ulcer has not healed. As long as the ulcer is open, you're inviting the bacteria for a dinner.
Again.
Because that is sweet meat. If there is a sweet left on the table and you're walking by, would you quick bite? You pick one and put in your mouth, right?
Yeah.
So on the foot, there's always bacteria. If there's an open wound, a diabetic, it's sweet. So the bacteria will always want to jump in and there. So you have to be very aggressive in your treatment to heal those things. If not, it's going to be a failure. Hopefully that explains it and summarizes in an easy way for you to understand.
Yeah, like so many steps. This is the most compact way you can put all the services in.
Okay.
Thank you, Dr. Mahesh, so much for your valuable insights about diabetic foot ulcers and wounds and how to take care of them.